Hello everybody. Welcome to the BCS webinar about journal peer review. We have today our three speakers, Professor Yu-Chuan Li, Professor Philip Scott, and Associate Professor Usman Iqbal. And I will let them introduce themselves to you better. And we will start with Li as our first speaker.
Okay, thank you, Ali. My name is Yu-Chuan Li. I'm the editor-in-chief of the BMJ Healthcare Informatics. I'm also a dermatologist and professor in biomedical informatics. Also the immediate past president of the International Association for Medical Informatics. Next, please. So today I'm going to, we are as a team, we have our deputy editor, Dr. Usman Iqbal, and Dr. Philip Scott. We're going to give you a very brief introduction of how the review process of BMJ Healthcare Informatics is going on, and how to become a reviewer, or if you're already a reviewer, how to best review papers that's submitted to BMJ Health or BMJ HCI, because we would really appreciate members from the British Computer Society to join our reviewer group and help us pick up good papers. Okay, so BMJ HCI is a journal that's a collaboration between BMJ Publishing and BCS, and it's also now a official journal of the International Medical Informatics Association. So as you can see, some of the statistics are here. We just got our impact factor a couple of months ago, and that's 4.1. It's quite it's fine in our field. It's above more that in the top maybe 20-30%. And so it's an open access journal, so anybody without subscription can access the paper once it's published. But of course, as all the open access journal, you have to pay a little bit of the publishing fee. The acceptance rate so far is 33%, and the time to first decision about 6 days. Next, please. And we have our deputy editors, Professor Philip Scott is with us today. And we also have other professors from Japan, UK, New Zealand, Australia, and Scotland. Next, please. And also from India, and Professor Usman Iqbal is with us. And we also have several professors from United States. Next, please. And this is our advisory board members. These are all very prestigious, very famous professors in our field around the world, including Dr. David Bates and Professor Enrico Correira. Next, please. And I'm not going to read the whole editorial board members, but as you can see, it covers most of the country around the world. Next, please. And especially, we also have a part-time social media editor, Dr. Hafsa Khan from Australia, and we have a special assistant for EIC, which is Dr. Anissa from Indonesia. Next, please. So our focus area, as it appears as a journal name, is the health and care informatics, which is the IT application in health and care and healthcare, and also in health and care. So health and care informatics, public health strategies, interventions, health policies, artificial intelligence, clinical decision support, electronic health record, and these are all covered by the journal. Next, please. So as you can see, these are the essential scope: the improvement in direct healthcare service provision, public health strategies, interventions, implementations of learning health systems, national policy issues. But of course, these will be relevant to information technology as well. Next, please. So so far, we have 10 different paper types to accommodate all kinds of different submissions. So as a reviewer, as a potential reviewer, you're going to receive some of these manuscript that's submitted for different paper types. Especially the most prevalent type will be original research, which is a word limit of 3,000 words and a reference limit of 30 and a table figure limit 5. A common one is a implementer report, which is 1,200 words, and short report, and also communication. Later is, of course, the smallest, the shortest format. And we also have a format called perspective that you can share your view for the future. Next, please. So I'm going to give you an example of some of the paper types. Like original research is easy to understand. In this example, the topic is changes in medication administration error rate associated with the introduction of electronic medication system in hospitals, a multi-site controlled before and after study. So it's kind of a trial, but it's a before and after study. So this is considered an original research, and it will report the results and the methodology of the trial. Next, please. A review is usually a systematic review and a meta-analysis, which is quite common right now. In this example, impact of diabetes self-management, education, and support app, intervention on medication adherence in type 2 diabetes, a systematic review and meta-analysis. So they review about 6 randomized trial and I think about 700 participants, and they provide a meta-analysis of the results. Next, please. Protocol is also one of the paper type that give you the design of a study, including a trial or among other studies. Like this case is the infrastructure and operating process of Pioneer, the HDR. It's a health data research. The UK data hub is one of the data hub. I think there are 8 or 7, around 9 data hub around UK. So it's the protocol paper about how the data hub will work, and it will be evaluated. Next, please. An educational report is one of our kind of a special type of paper because we really want to focus or emphasize the educational efforts of health and care informatics. So in this case, in this paper, this example, machine learning in medical education, a survey of the experience and opinions of medical students in Ireland. So that's part of the experience sharing and survey of the impact of teaching machine learning to medical students. Next, please. And also one quite popular type of paper is called implementer report, because BMJ HCI, the journal, want to emphasize on implementation science, not just basic research. We also want to emphasize real implementation experience and user response and things like that. So in this case, it's the example is a rapid implementation of Microsoft Teams in response to COVID-19, one acute healthcare organization's experience. So this is not original research, but rather a full course experience of how to do this in a short period of time in response to the COVID-19 crisis or pandemic. Next, please. Or a short report, like in this example, it's a comparison and impact of COVID-19 for patients with cancers, a survival analysis of fatality rate controlling for age, sex, and cancer types. So this is to report a limited set of data, a preliminary finding, but it's also very important, a timely report. Then a short report might be a format that you want to choose. Next, please. In communication, of course, you probably all were quite familiar with communication. It's an idea, innovation, or an important contemporary issue. Like this example is the clinical artificial intelligence department, a prerequisite for success. It's a promotion for hospital to establish a clinical AI department. Next, please. Okay, so I'm going to hand over to Professor Philip.
Thank you, Jack. So briefly, my day job is at the University of Wales, Trinity St David in Wales, obviously, as it's University of Wales. And I'm leading a MSc in Digital Transformation for Health and Care Professions. I'm also the chair of the BCS Health and Care Group, obviously here today as one of the deputy editors of this journal. And for the UK, I'm the national representative to the European Federation of Medical Informatics and the International Medical Informatics Association. I'm also on the board of HR7 UK, so interoperability interests, and I co-chair a working group on computable biomedical knowledge. So next, please. So this is the heart of the process. I'm just going to walk you through step by step. So if you're not familiar with peer review, this is the mechanics of how it works. So we start at the top left with authors, and you see you've got steps 1 and 2. So the authors initially submit their paper to the journal through the journal website, and there's a kind of pre-check that's done by the journal administration team to make sure it's in the correct format. They've filled in all the boxes, they've answered all the questions, and that from an administrative perspective, it's acceptable to be submitted. So that then comes to the editorial team, and the editor-in-chief will then will either decide to reject the paper immediately. We do sometimes get papers submitted which are out of scope for the journal, or which are of such low quality that they're not worth reviewing. That's very rare, I would have to say, but it does happen. So the editor-in-chief may immediately reject the paper. Most often, it will be assigned to one of the deputy editors to then manage the review process. So that deputy editor then becomes the handling editor for that particular paper, and at any one time, each of the deputy editors will have several papers which they are managing through this process. So then step 3, what the deputy editor then has to do is assign the peer reviewers. And that's usually a combination of searching our database for people who have the appropriate skills, who have published on that subject themselves, or who are known experts in a particular field. So we're able to search for those people and allocate them or invite them to review the paper. And then we also have our own personal contacts. So we will know people that we think are appropriate to review particular submissions to the journal. Now, I have to say, on a practical level, that is probably the hardest point, is getting enough reviewers to review a paper, because we're all so busy. And reviewing an article isn't a 5-minute job. It does take a little bit of time to work through the paper properly. And that's why we're having this webinar, is to get more people to come and help us who are willing to work through that process. So we move on to step 4 then, and we'll go through what reviewers have to do in a bit more detail on a future slide. So then we send it out to a group of reviewers. So initially we'll typically invite perhaps 4 or 5 or 6 different reviewers, because we know that only a minority will actually respond and accept the review assignment. But then for those who do accept, so as long as we've got 2 or 3 reviews that come back to us, we're then able to make an initial assessment of the paper. So when the reviews come back to us, this one doesn't actually have a number, where it says above 4 reviews returned to editor. So they come back to the handling editor, the deputy editor at this stage initially, who will then look at the peer reviews and then make their own assessment. So generally speaking, reviewers will come back with roughly similar comments. Occasionally there will be contradictory reviews. You sometimes get situations where one reviewer thinks the paper is marvellous, another reviewer thinks the paper is awful, and then the deputy editor has to make their own judgment as to what recommendation to make. So the deputy editor makes a recommendation to the editor-in-chief. So there's a range of options. We could recommend rejection, we could recommend immediate acceptance, but most often it's either minor revisions or major revisions. It's very seldom that a paper comes through without needing any amendments. So the deputy editor will make that recommendation to the editor-in-chief, who'll then make his assessment, and he'll then make the decision of what to tell the authors, either that they've been rejected or that there's been some form of revision required. And that email will include a summary of what the peer reviewers have said, and then the authors will be invited to revise their paper, resubmit it, and importantly, when they resubmit, they have to give a point-by-point response to what the peer reviewers have said. So when they resubmit, that then comes back into the editorial team. Depending on the level of revisions required, usually it will go back to the peer reviewers to look at the revisions and see if they have adequately addressed the comments that were made in the initial review. Sometimes that goes round more than once. Sometimes the revisions are not quite good enough and we have to send them back again. So typically, if there's been a paper that needed major revisions, when that comes back, it's better, but still not quite good enough. And so quite often that will have to go back again for further minor revisions. But then ultimately, once we've been through that loop a few times, once the peer reviewers are broadly satisfied and the deputy editor is happy to make a positive recommendation or a negative recommendation, again, that goes back in step 5 to the editor-in-chief, who will notify the author of the final decision, either to accept or reject. And then step 6, the article goes through the production process, so the formal proofreading, the checking of references and so on, that is necessary for it to go into the correct format to be published on the BMJ HCI website. So as you can see, there's a number of steps involved there, but overall, it's actually a fairly simple process. We assign the peer reviewers, we get the comments, we make a recommendation, an iteration of revisions until we get to the final decision stage. So as a peer reviewer, the key thing is step 4, being willing to accept the invitation. And then what we're going to look at later is what that review actually involves. So let's go on to the next slide, please. So next slide, if we can, please. We'll get there in a moment.
Yep, I think it's taking time. I already pressed.
Okay.
Have you seen that?
Not yet. This is
No.
no. This is a metaphor for how long the peer review process takes.
Maybe you want to
Can you see that?
unshare and try share again. It's not moving.
Yeah.
How about now?
There we go. That's it. Thank you very much. Good.
I
Okay.
think it's okay.
Yeah, I took over. Please continue, Philip. Thank you.
Okay, thank you. So, so the question of how to peer review. So, the fundamental question is what contribution does this article make? Is it actually telling us something that we didn't know before? And so therefore, you would need to have a reasonable understanding of what was known about this subject previously. So you're asking the question, does it give adequate coverage of previous work in the field? Now, obviously, none of our reviewers know absolutely everything about absolutely everything. So sometimes you're going to have to do a little bit of digging to see, well, what are the most important or the most recent papers on this subject in the field. It may be that it coincides very closely to something that you are very familiar with, in which case you can simply give a personal assessment of that. So that's the first thing to think about, is it actually telling us something worth knowing? And is it novel to some degree? Having said that, of course, it could be, and we in all fields there's a lack of this. It could be a replication study, and replication studies are very important. So in that case, it may not be telling us something new. It may be just confirming what was previously known and therefore strengthening the evidence base. So that's the first key question then about contribution. And then most importantly, does it read well and make sense? So some people are very good scientists, but very bad communicators. So it needs to be logical, it needs to be clear, it needs to be well explained and coherent. If there's a lack of clear message, as the last question there says, then it may be so badly written that we just have to reject it. Or it may be that we can rescue it through major revisions. So we've got content in terms of contribution, and we've got the clarity and the quality of the writing. And then for all original articles, we're talking about, is it genuinely original? Is it significant, or is it just a trivial finding? What is the importance of the work to general readers? How many people is this going to be important to, or is it just a very, very niche topic? And then in terms of their methods and the way they've executed their methods, is it scientifically reliable? Is it good evidence that we can publish? So next, please. So in terms of recognition for reviewers, we've got 5 steps listed here. So first of all, the article processing charges. So as Jack was describing, for open access journals, there is an article processing charge, that's the publishing fee, and reviewers will receive a 25% discount on open access charges if they submit an article within a year of submitting their review. There's accreditation through ORCID, and if you're not familiar with ORCID, it's a unique identifier for everyone who publishes in the academic field, and it enables you to link your ORCID profile to the reviews that you've done. So you get credit on your ORCID profile for each of the reviews that you do. Now, step 3 is still future for this journal, but BMJ more widely has a recognition process through the Cleveland Clinic to offer continuing medical education credits for timely reviews. So that's something we don't yet have, but BMJ are working on that as something for the future in this journal to provide that Cleveland Clinic CME accreditation. Step 4, we also provide annual certificates. So BMJ is able to recognise through a formal certificate that you've been a reviewer for us during a particular year. And then also annually, step 5, we publish reviewers for all BMJ journals, which are available through a public list. So things you shouldn't do. Now, when you fill in your review form on the website, you have one box where you write comments to the editor, and you have another box where you write comments to the authors. So generally speaking, you only need to give comments to the editor if there's something particularly sensitive or difficult, where you want to be maybe a bit more frank with the editor than you are being with the authors. But the important thing is basically say the same thing. You can probably be a bit more direct when you give comments to the editor. You probably need to be a bit more polite when you give the comments to the authors, but you need to basically be saying the same thing. And that links into the second point. You can be critical, but you need to be polite. There is professional courtesy here. So you just need to make sure that you word it in a way which is constructive. You can be quite specific. You can point out if something doesn't seem to make sense, or the results don't actually lead to the conclusions that they've claimed, but you do need to do it in a professional way. The third point is confidentiality. So when you receive a manuscript for review, you're not allowed to share it with anyone. It's done under a duty of privacy that only you have access to this for review purposes. You mustn't share it more widely. The next point is don't accept it if you know you can't do it. It's much better to say no than to hope you can do it and then not do it. So you need to be realistic about your availability. The penultimate point here, don't exceed your skills or ability. If it's a topic which is completely outside your knowledge, then don't attempt to review it, apart from an exception that we'll come on to in a moment. So you need to be honest about what are the things you do know about and what are the things you don't know about. And then the last point is you're not there as a copy editor. You're not there to remove every false comma or put in an apostrophe or whatever it might be. So that's not what this is about. This is not about grammar. This is about content when it comes to peer review. Next, please. So what we are interested in, as well as kind of traditional academic review, we are also interested in peer review by patients and the public. We have an active patient and public involvement program where we're getting patients and public involved in both review and indeed writing for the journal. And where there's something which is of direct impact on patients and public, it's very appropriate to get a patient and public review. So if there's something that affects how care is delivered or how patients are communicated with, then to get a patient perspective on that is really helpful. So they may not understand some of the technical content, but they can give us a view on the patient perspective and how they understand what the article is saying and how it affects patients. So that's certainly something either yourself or colleagues who could become a patient or public reviewer, even if you don't feel qualified to offer an academic review. So I think that's the end of my section. So I'll hand over to Usman now.
Thanks, Philip, and thanks, Jack, for setting the scene. So my focus will be more on how the examples of the reviews, the different types of reviews. So myself, a brief is I'm Associate Professor in Global Health Informatics, adjunct faculty with the UNSW in Australia. I've been involved with the Odyssey and also fellow of the International Academy of Health Science and Informatics and also Australian Institute of Digital Health. And I'm a deputy editor with the BMJCI. Next, please. So I will give you some few examples of the review, and this is some of the comments just to give you a flavor that how exactly the reviewers provide feedback might be helpful. So first, this template is giving an example of a rejection when the reviewers, they raise some concerns about that. So for example, there's an abstract, and you can see there are some comments from the reviewers, like specific comments on the title, that the title is not very clear. It's not really exactly telling about the study and any findings or the key standings in that. And also the background does not really justify the study and the aims are not very clear. So imagine that every paper, the abstract is kind of, standalone structure piece, which is kind of, you're trying to sell your study. So this is how it should be structured well. So if your abstract is not clear, in some cases, you can't able to access the full paper. The abstract is the only standalone piece where you can able to understand the whole study, the concept of the study. So it has to be very clear and crispy, including the title, background, objectives, methods, results, and the discussion section. So it's not really clearly articulated that how the study intends to address this broad challenge and haven't specified what aspects of the data management practice and associated factors, exploring, and that were important to understand. Next, please. So this is also part of that. So for example, just the rejection is not just based on the title or abstract or the one of the two contents. It's based on the throughout the paper of the different sections. So methodology section is also very important, which is usually called the backbone of the paper, which has to be very clear and robust as well. So in this case, you can see that there are some information provided in the questionnaire, which was not very clear and kind of, the biased in that, which reviewer flagged to the authors. And also specific comments to the results, which, specific comments from the reviewers were like, it would have been interesting to learn more about what their expectations were with regard to the app. So it was not clear from the author's perspective. Sometimes the studies is very good, but the way you actually trying to present a writing is not some, all the time it's very good or robust. So it has to be flow nicely and to provide the maximum information in the very last few words. Then specific comments to discussion. You can also see some of the comments, and these are the examples which took from, and it is anonymous. So the authors need to discuss what the expectations of the interviews were. So that was also not very clear from this particular study. So instead of asking about the success and failure, less emotional terms could be used. So there were some examples like asking what went well and what needed improvement, and about the positive and negative aspects as well. Next, please. So this example particular provide on the major revision. So the papers which usually undergo the revision, where there are some opportunities for authors to revise the content based on the reviewer comments. So editor thinks that this paper has potential, but it needs to go through some of the comments to improve this further based on the reviewer comments. In this particular example, you can see that the table has the data, but the table ligand, the title is not very clear, it just says inclusion and exclusion criteria, but not really providing further information that what is exactly about the inclusion and exclusion criteria. And the second, you can also see that the information sources in the search strategy. So authors might have presented the information, but not really provided the good titles, which are providing enough information that what is this particular title or figure about. And also some of the other details to be included in the system, for example, risk of bias, if you're doing any systematic review or other studies, the main components of the particular study. So based on the comments, usually the editors decide whether this paper has an opportunity that the authors, they don't have to do much extensive work and just need some particular time frame work, and then this is able to do within the time frame and able to submit. In some cases where they have to where the reviewers think that the data has to be reanalyzed or have to revise or you have to go extensively, and then editors might take a decision to reject given the consideration of the time frame, that it might not be able to done within the time frame. So they have to redo the whole structure of the study or to rerun their analysis as well. Next, please. So this particular example is giving a minor revision concept. So for example, like in this abstract, you can see that the minor corrections, for example, the authors use the language learning models, and then in the other instance, in the introduction, they're using large language models. So they have to be consistent throughout the paper. So in this paper, the paper is very good throughout, but there are just minor corrections that need to be done. So to be consistent with the terminology, this could be typos during when they are writing the drafting paper with the automatically switching, or sometimes they're confused with the terminology. So it has to be consistent throughout. So then the reviewers usually raise these concerns because there's a saying that that there is no one else in the the academic who will review your paper compared to the reviewers who are going in depth throughout your paper. They will be doing the most extensive, thorough review of each and every single word. So that's why they raise some of the basic concerns. And as already Philip mentioned previously, that you don't have to, as a reviewer, to do the corrections, but you have to flag and write that these are the things which you have to do. So in this case, for example, these are the minor corrections, just to give you an idea. So in this case, the editors think that these are just the minor things. The paper is good, is potential, the topic is very timely, so they would encourage and then give the time frame of that. And there's also a difference between the minor and major revision time frame, usually, because there is expectation that the authors usually, they will able to revise this particular paper, the minor revision within this time frame, and the major might need a little bit more time. So there's a different time frame for that as well. Next, please. So this is an accept decision. So you can see here, this is a letter type of response to the paper where the reviewers think that this is very potential piece of paper, and it is very timely and raising a good points, and does not really need to be done anymore, any further thing or correction stuff. So in this case, they usually provide some kind of comments like, raise a valid point about the importance. And also the reviewers understand the challenge. For example, like in this particular case, the authors, they can't really evaluate the ChatGPT 4 compared to the ChatGPT 3.5 because of the time frame. So, and the release of that. And that's why, the reviewers understand and they recommended to accept this. And because overall the piece was good, there was no other concerns on that. Next, please. Yeah, thank you. So these were the examples. So we're happy to have questions. Jack and Philip, back to you.
Yes, thank you, Usman, Philip, and Jack. Thank you for your very informative speeches. So if people have any questions, if the attendees have any questions, please feel free to type them on the chat. And to get started the Q&A, I thought to ask a question myself. So in a lot of peer reviews, that there is a tick box that says, do you have any conflict of interest? What do you think a conflict of interest is in a peer review? How would somebody that hasn't done a peer review before be able to handle that? What do they need to know?
I can offer a comment on that.
Okay.
So in that context, so in the broader sense, conflict of interest normally means something financial or something ethical, but in a peer review, typically it's is this a colleague that you have worked with on this project or a similar project recently, or are they just a friend of yours? So anything which would give bias to your review, you would need to, if a paper came to you and it was a friend of yours, you'd just have to decline it because that would be quite inappropriate. Again, if you're not sure, then by all means email back to the editorial office when you're invited, and if you describe what the relationship is, if any, they can provide guidance. But broadly speaking, is there anything that might be seen as altering your opinion, either in a positive or a negative way? It might be somebody that you hate, and the same principle would apply there. You shouldn't review something written by an enemy.
Okay, thank you so much, Philip. We have a question from the audience, and how do we sign up and register as a reviewer?
Usman, maybe, or Philip, go ahead.
Yeah, so there are two ways. You can register yourself on the ScholarOne platform as a reviewer. You have to create an account, or you can just drop us an email and we can keep you in a record and send you the relevant papers according to your area. So I mean, definitely your area will be within the scope. But if you will be sending us an email, so we will keep you in a separate file instead of having ScholarOne. But then once you will have an email to us, we will automatically register you in the ScholarOne, so you don't have to do it. Right? And then we will send you invite for the particular papers as it comes. So either two ways, but I think the better is you just drop us an email, and then we will pick up on that. For that, you're showing your expression of interest that you want to be a reviewer for the BMJCI. Yeah, that would be great.
And I've just put into the chat the website, which will take you to the journal page, which is given here on that last slide. Yes. So that's got the contact emails as well. If you so rather than contacting us individually, it's probably best if you go through the editorial office email, which is given on that page.
Yes, and once you have reviewed the first paper, you'll be asked to register a reviewer's account, which you specify your specialty and area of interest and things like that. And then from then on, you have more chance to get picked up as a reviewer if we have a paper that match your specialty or area of interest. So yeah, the hardest is to get the first one, but then it gets easier.
Yes, thank you. There's another question. What is the threshold, if any, to be an academic reviewer?
Well, there's no specific threshold for that, but usually we would hope that you have published something yourself before in an academic journal, or you have a research degree or a research experience in that specific area, and you've read enough publications from that area. Now, Philip, you want to add something?
Yeah, I was going to add to that. As you said, no, there's no specific threshold. So, for example, I've often asked my PhD students to do peer reviews if it's sufficiently close to the topic they're working on within the overall field. So, I would say if you're unsure, then register yourself anyway. And then it just depends on the papers that come through to you. If it turns out the papers that come through to you are beyond your expertise, then you just have to decline them. But I'm sure there will be, the fact that people are aware of the journal and have come to this event indicates you're probably part of a community which is pretty close to the level of knowledge we're looking for. So I would err on the side of volunteering and then just take it paper by paper and see what comes through to you.
Thank you, Jack and Philip. On that note, can I ask, when I started, I was not able to review 100% of the paper. What happens when somebody can review 70% of the paper and, for example, they cannot review the quantitative or the qualitative analysis or some sort of aspect? What happens? What a reviewer should do?
Okay, that's a good question. Yeah, that I haven't actually thought about a partial review, but usually if you comment, if you think you want to contribute and you can contribute significantly in, for example, the method session and the discussion, but not the results, for example, then you could say, my comments are this and that for this specific session. As regard to the results, I have no comment because that's not my area of specialties or whatever. You could say something like that, but it's could still be a helpful review. Of course, the handling deputy editor will consider that. When they're consider the overall acceptance of the paper and the comments, right? So maybe there will be some discount on a incomplete review, but I think it can still help. Yeah.
I know on some, I can't remember if we got it on this journal, but I know many journals that I've peer reviewed for. When you come to the final summary recommendation, there's often a box that says, are the statistics good enough, or are you not qualified to comment? So that's typically the thing that most people would say, I don't know enough about that particular statistical method to say if they've got it right or not. But as Jack says, you can always put that in the narrative anyway and just say, I can't comment on this section. So that I think that's perfectly fine.
And I think it's always helpful, even you have a partial review, because it will help editors at least to proceed further instead of just saying that, not at all, you are not submitting, even you have reviewed half. So it's better, whatever you have reviewed, to submit, even if it's a partial, and adding the comments like Jack and Philip just mentioned. So I think that's very helpful still.
Yes, thank you for that. And apologies for the hard question. There is another question, an admin question. Will the slides and recording be available to attendees? Yes, we will. We are recording, and in a few days or a week, everything will be available to attendees. Philip, am I right?
I hope so. I think the intention certainly is that we'll have it available on the BCS Health and Care website.
Yes.
And Jenny might be able to confirm if it will be on the BMJ HCI website as well, or just a link one way or the other. So yes, it will certainly be published, and we've got the list of attendees, so we can ask BCS to notify you all where the information can be found. Yes.
There is another question. does BMJ HCI accept think pieces?
Yes, it can be in the form of a communication, a letter to the editor, or if it's more complete, it can be in the form of a perspective paper. So there are like 10 different types that in my previous introduction. And so 3 of them will fit something like this.
Thank you all. Are there any last questions, last minute questions? Philip, I believe we have a number of we might have a number of students or early career people with us. So what would be a CV or a biography benefit to do a peer review?
Well, again, you're absolutely right. The fact that you have become involved in the international scientific community by becoming a peer reviewer is really important, because this, science is a collaborative process. Publishing is an important element of that and building the knowledge base. And so, yeah, it's a great thing for people to have on their CVs. And we mentioned the forms of recognition that are available. So for early career people, something like a certificate of recognition, it can be helpful sometimes. So as I said earlier, I think for people who are, if you're not sure whether you can do this, do it anyway. Volunteer. It's much better to put your name forward and see what comes out, rather than think, oh, no, I'm not clever enough for this. There's particularly for early career people, there's the good old I don't remember the name of it now, like pretender bias. What is it they call it? When imposter syndrome. That's it. When you don't think you're clever enough to be able to do this particular thing. And you usually are, actually. I mean, some people are overconfident, but if you've got imposter syndrome, you need to get over it and realize you're actually probably brighter than you think. And I was going to say something else from that. And the other thing is, you learn so much from doing it. I've learned so much from peer reviewing papers. I've looked at papers and I think, I'm not sure if I know about that. And I read the paper and I realise, oh yeah, I do know that half of it. I didn't know that half of it, but I've learned a lot from reading that. So it is also a brilliant learning opportunity, as well as an opportunity to contribute to the scientific community.
Yes, thank you. So thank you all for your insights and the answers to your questions. Do any of you, Jack, Philip, Usman, want to say anything as we might have missed, or you have any further comments?
I'd just like to thank everyone for coming.
My only suggestion is that if you haven't been a reviewer, try to be one. I mean, there's no such thing as a wrong reviewer. You can contribute more or less, or whatever you like, or you can decline after you look at the paper. But just try your first one, and it gets much easier the next one. Yeah. Okay.
And it also helps in the career. Yeah, I think it's really helpful for early careers as well, to come and see, and get an experience of the different research coming into your field. And as Philip and Jack mentioned, you can learn a lot. So, and exactly similar, even though, we are doing research, but every day there are some things new comes in, and then it's a lot of learning. So it's also another way of keep yourself up to date with the latest research.
Okay, that's great. Thank you, Professor Jack Lee, Professor Philip Scott, and Associate Professor Usman. Thank you all for attending, and thank you all for your questions. I hope you enjoyed that. And as we said, it will be available to the BCS website, potentially to the BMJ HCI in a few weeks, given the admins.
Thank you, everyone.
Thank you, everyone. Thank you so much. Have a good day.
Thank you. Bye-bye.
Bye.
Bye.